to reduce the clutter on your table, you need a direction. So something like PrepLadder gives us that direction. You have some 40 hours or 50 hours of gynecology.
I have given all the content of pharmacology.
I have contributed the entire content for internal medicine.
I have created the content for PSM.
You can trust the questions and explanations to be genuine.
Detailed explanations will help you solve the different variations of the same question.
Textbook references will help you authenticate an answer.
I have created this content after close inspection of the previous year questions.
I have put in my 14 years of experience into creating these questions.
Includes the latest exam questions, questions on the recent updates, as well as image-based questions.
All questions are according to recent exam trends and difficulty level.
So the software would be exactly like the real exam.
All your queries come directly to me. So if you have any kind of doubt, you can ask me directly.
I'll be solving all your microbiology related queries.
You can ask anything about the subject, doesn't have to be only about a question.
I'm always available for you whenever you need help.
You can have a counseling session with me.
So we've put in features to make sure you keep studying. The PrepLadder app will never let you fall behind.
Solving obs and gynae questions will be easy for you after this.
You would not have to worry about anatomy at all.
You will be able to solve most of the questions in PSM.
Most pathology questions in the exams are going to be derivatives or the repeats from these questions.
1 lakh competitors.
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 It's good to see that everyone in the team is giving their best.
This is the best team of faculties that could have been put together.
This is the biggest innovation in medical education.
We are obsessed with making sure that you get the best value out of every minute spent on the PrepLadder app.
Really happy to be a part of Team PrepLadder.
You know, if there was something like PrepLadder when I was preparing, I'm sure that I would have prepared much better because I would have known what to read. Hi, welcome again. Let us read about twin pregnancies. Twin pregnancies, like we say, is double the trouble, both for the obstetrician and the woman who is going through it. So yes, everybody in the family loves to have twins, everybody in the world likes to see twins. But then the woman who is going through this pregnancy and delivery, we always say any problem which can go wrong in obstetrics, there is double chance of it happening in a twin pregnancy. So yes, what is the incidence of twins? Twins, we see 1 in 80 pregnancies, we see triplets 1 in 80 square pregnancies, and we can see quadruplets 1 in 80 cube pregnancies. This is what is the Helen's law about twins and triplets. Now, what kind of women have more twins as compared to others? Increased age women, increased parity women, increased weight women, blacks more than the Caucasians. Countries like Nigeria, they have every 20 pregnancy there is a twin. And then very important, infertility treatment. All those clomiphene citrate inductions and the IVF done, all of these will increase the incidence of twins. So what are the problems which are more likely to happen in twin pregnancies as compared to normal pregnancies? So let's see category wise, what are the maternal problems? First trimester abortions will be more, and there will be also more hyperemesis, more preterm labor, more association with conditions like hypertensive disorders, preeclamptic toxemia, diabetes mellitus, and postpartum hemorrhage, very important. Big size of the uterus, it takes much longer to come to the contracted state after the delivery. What are the problems which can happen in the placenta? Placenta is big because there is one placenta serving two babies, or sometimes there are two separate placentas. So of course the incidence of placenta previa will increase, and abruption also increases, cord entanglements, and abruption because of the cord getting entangled into the other twin, that is also a serious problem. Then premature rupture of membranes. What are the problems which are peculiar to the fetus? Now the fetus can have intrauterine growth restriction, and there can be growth discordancy. A single fetal demise, and then congenital abnormalities, malpresentations, twin to twin transfusion syndrome. Now these are some of the things which I have recalled, some of the things which generally come in exams, that is why I have enumerated those. Now let us see what is the method of formation of twins. So to understand that, let us see what is the normal sexual reproduction. So what happens at the levels of the gamete? If we see the oocyte has dispersed genetic material like this in the ooplasm, and when the sperm fertilizes the oocyte, the sperm comes with a nucleus in the head. So sperm nucleus will give a pronucleus, and the genetic material of the oocyte will also condense and make a pronucleus. Now the oocyte will always have a 23X, the sperm may have a 23X or a 23Y. Now this is the pronuclear stage. After that, the two pronuclei will fuse and make the stage of a zygote, in this case a 46XX. Now the zygote is the state when there is a mixing of the genetic material and selection of the good characters or the bad characters, the selection where this person is becoming tall or short or dusky or fair or intelligent or stupid, all of that is happening at this level, and after that these zygote will split into two cells, and after two cells it will be a 4-cell stage, that is the day 3, and then after the 4-cell stage it becomes a morula. You know, morula is the stage when there are 16 to 32 blastomeres, and then this will start differentiating and making a trophoectoderm, an inner cell mass. So the ICM, inner cell mass, and the trophoectoderm, and the blastocele cavity. So this is known as the blastocyst. The blastocyst is the state which is the day 5. Now after this day 5, from the blastocyst, the oocyte shell will break and the contents of the blastocyst will go out, and that hatching is the event just before implantation happens. So yes, please remember, we humans also undergo hatching. Yes, from the blastocyst, the contents of this blastocyst will go out and implant on the uterine wall. So this inner cell mass will make the fetus, and the trophoectoderm will make the placenta. Now we discussed that when one sperm enters the oocyte, it makes a singleton baby. Now I have drawn this for you. If one oocyte is fertilized by 2 sperms, what will happen? Will it make twins? Monozygotic? Dizygotic? No, twins are not made like that. This makes something else. Let's see how are twins made. So, we discussed that there is this morula, and if this splits into two halves, for example, then there will be one baby made by the one half and the other half will make another fetus. So, yes, this is one zygote giving two babies. We all know this is the monozygotic twin, and since it is from one zygote, these are the identical twins, and the incidence of this is 1 in 250 pregnancies. This is a very common MCQ because the incidence of monozygotic twins is constant across all races and all parts of the world, 1 in 250 pregnancies. Now, if there is a uterus with one oocyte which gets fertilized by one sperm, another oocyte which gets fertilized by another sperm. Now, this is going to make two babies from two different sperms and two different oocytes. So, yes, that is what you know is the dizygotic twin. Now, dizygotic twins are also known as the non-identical, also known as the fraternal twins. Now, these non-identical or the fraternal twins, they can be of the same sex, but they can be two different sexes. Yes, it can be one tall boy, one short boy, it can be a boy or it can be a girl, alright. In fact, dizygotic twins are the more common twins. You know, we tend to remember twins because they look the same, but sometimes you may see a boy who is having a twin who is not a boy, who is a girl. So, yes, they can be twins of different sex, and those twins you don't remember so easily, isn't it? Because you've seen two different sexes, you've seen one boy and a girl, so you generally don't relate them to be twins, isn't it? That's why dizygotic twins are far too many. They are far more common than the monozygotic. 1 in 60 to 1 in 80 pregnancies are the dizygotic twins, and dizygotic twins can have even more problems, that one oocyte can get fertilized by the father and sometimes the second oocyte gets fertilized by the neighbor. Yes, that can also happen, we know that. We have seen, I think if you read your Williams obstetrics or your books of forensic medicine, you will see that the examples of a white woman giving birth to a white baby and the second baby is a black baby when they were twins. So, yes, that can happen. Dizygotic twins can be embarrassing sometimes. So, yes, those are the incidences where you use your terms like the superfecundity, where there are two oocytes in one cycle, or superfetation. Superfetation is two oocytes of two cycles. So, these are the ways how the dizygotic twinning can happen. Now, what do you understand by superfetation? Superfetation is slightly tricky. You know, superfecundity, we know one oocyte, one sperm, another oocyte, another sperm making two babies in one cycle. Now, superfetation means this woman has ovulated this month, the oocyte got fertilized, made an embryo which got implanted. Now, when she was pregnant, next month, in spite of being pregnant, some freak in a biology and she ovulates again, and next month she conceives with another act of intercourse and makes another embryo which comes and gets implanted now. So, yes, two cycles, two oocytes. This is a very rare phenomena, okay. This is commonly seen in cattle, it is seen in horses, and it is not a very common human phenomena. In fact, whatever cases of superfetation have been reported in science are all doubtful cases. So, yes, the next MCQ they ask you is, what is the most common type of dizygotic twinning in humans? The superfecundity. Superfecundity is the common type of dizygotic twinning in humans, alright. So, let us see the twinning a little bit more closely. In dizygotic twin, we always have one placenta and another placenta separately with two different sacs and two different babies. Now that is the best twin to have obstetrically. Like everybody likes to have twins, isn't it? But as an obstetrician, I would like to see two different placentas and two different sacs, dichorionic and diamniotic always. That's the best thing about dizygotic twins. What is the problem with the monozygotic twins? Actually, the monozygotic twins, they are no problem if they divide early. They are no problem if they split early. The problem happens when they take more time to split. So yes, let's see, based on the time of splitting, monozygotic twins can be of 4 different types. If the split of the embryo happens before the 3rd day of embryological life, so there will be always 2 placentas and 2 sacs in these cases, because the split has happened in good time. So that's why it is called a dichorionic diamniotic twin. Now if the split happens after 3 days till the 8th day, then there is one placenta with 2 sacs. And if the split happens after 8 days, then there is one placenta, one sac with 2 babies. But if it happens even after 12 days of the embryological life, that's the time when the embryonic plate is already formed. Now when the embryonic plate is already formed, then one embryonic plate can serve the development of only one baby. Now the embryonic plate is formed and now the cell mass is split. Then there will be one placenta, there will be one sac, and there will be 2 fetus, but these fetus might be stuck to each other. Like in this case, I have shown that they are stuck to the head. So this is a craniophagus, isn't it? These are what are known as the Siamese twins or the conjoined twins. Yes. So this is a craniophagus which I have shown you, but the most common conjoined twins are the thoracophagous. So yes, this was when they were splitting happened before the 3rd day, there is a dichorionic diamniotic. From the 3rd to the 8th day, it is a monochorionic and a diamniotic. And if it happens after 8 days, it's a monochorionic and a monoamniotic. So the problem is that after the first category, the category after the 3rd day of embryological life, when there is splitting, these will have sharing of the placenta, sharing of the sac, or sharing of the organs. So these are the twins which are problematic twins. So that's why when there is sharing of the placenta or sharing of the cord, there can be many problems. The best monozygotic twin to have is the one which is splitting less than the 3 days of embryological life, and this happens in how many percent of cases? 35% of cases, MCQ. So the number of monozygotic twins which can be dichorionic diamniotic is 35%, which is just like the dizygotic twin, which also can be, which always can be dichorionic and diamniotic. So I said I like dizygotic twins because they are always dichorionic and diamniotic. I'll have to change my statement. Now I'll have to say that I like dichorionic diamniotic twins, whether they are because of dizygotic twins or they are because of monozygotic twins. Either ways, I can have dichorionic diamniotic, always in a case of dizygotic twins, but in 35% cases of monozygotic twins. So yes, now what are the problems beyond this first stage? Remember, the earlier the embryo split, the better they split. The earlier the embryo split, they split better. They split less than 3 days, 2 placentas, 2 sacs. They get a little late in separating, 1 placenta, 2 sacs. A little later than late, 1 placenta, 1 sac. Very late split, 1 placenta, 1 sac, and the babies are also stuck. So the later they split, the more they are stuck. So it's best to have a split before 3 days of life, and that is the best type of monozygotic twins because they are dichorionic, diamniotic. Always remember, when you're giving the nomenclature of monozygotic twins based on the days of split, always mention the chorion, the placenta first. Dichorionic, diamniotic, monochorionic, diamniotic, monochorionic, monoamniotic, like that. If you go the other way, then you may get confused. All right. So yes, now what are the problems in the monozygotic twins which split after the 3rd day of life? So those may have a common placenta. If there is a common placenta for 2 babies, then there is a problem that the blood vessel of one of the babies might be draining into the blood vessel of the other baby. So yes, what are the problems peculiar to the monozygotic twin? I have already told you the problems of twins in general. The twins in general will have problems which I discussed in the beginning of the chapter. Monozygotic twins may have a twin to twin transfusion syndrome. The anastomosis which is responsible for this is the deep arteriovenous anastomosis. This is the reason for a twin to twin transfusion syndrome. The hemoglobin difference is more than 5 grams per deciliter. That is, the donor twin will have a hemoglobin 5 grams lesser than the recipient twin. Needless to say, the donor twin will be anemic and the recipient twin will be plethoric, and the recipient will also not be doing too well because there will be just too much of blood to pump. He will be in a hyperdynamic circulation, and too much of blood increases the oncotic pressure. He will be having congestive cardiac failure, and this baby will also not survive because he's got problems of too much of blood, and the donor will not survive because he's got the problem of leaving too much of blood. So the diagnosis is made by a HP difference of more than 5 gram percent, more than equal to 5 gram percent, or a weight difference of more than 20%. They can also be discordant twins, discordant because of twin to twin transfusion syndrome or many other reasons. It can be based on the abdominal circumference where there is more than 15% difference, or the weight which is more than 20% different. Now then, there can be other problems which are peculiar to the twins, like the cord entanglement, or the single fetal demise, abruption because of one baby inadvertently pulling the cord of the other baby, premature rupture of membranes, sepsis, intrauterine death of one or both fetuses. So yes, since monozygotic twins can have problems after the 3rd day of split, that's why I said it is not very good to have monozygotic twins. Obstetrically, it's not very good to have. So when there are likelihood of problems like this to happen in a monozygotic twin, it's better that we terminate the pregnancy much earlier than full term. 37 to 40 weeks is the time for all normal pregnancies to terminate, but in twins of the monozygotic types, where we are seeing on the ultrasound sharing of the placenta or sharing of the sac, it's best that I take them out by 34 completed weeks. Quite a few people do even at 32 weeks with steroid pre-administration, and it's always by a cesarean section, Now, with this exercise, we have understood that it's best to have dichorionic and diamniotic twins. You know that these can happen always when there is a dizygotic twin, can also happen in less than 3 days split in 35% of monozygotic twin. So now that we've understood that dichorionic twin and diamniotic twin is the best to have, then we should look forward to diagnosing this in the early pregnancy itself. So we do some chorionicity estimation measures. That's getting a little complicated term, right? So chorionicity scan, we can call it chorionicity scan. That is, we can do an ultrasound, and on the ultrasound we can see 2 placentas and 2 sacs. So if you see 2 placenta and 2 sacs, then we are happy, dichorionic, diamniotic. Or we see 2 different sexes, that there is a male and a female, 2 different sexes, then we know it has to be 2 different placentas and 2 different sacs. But yes, sometimes on the ultrasonography, you may not be able to see 2 placentas so clearly. There might be actually a large placenta like this, which is actually a large placenta sometimes, but sometimes it is not a large placenta, but there are 2 normal side placentas which are stuck to each other. So yes, if there are 2 normal side placentas which are stuck to each other and you are not able to make on the ultrasound, then there are some subtle signs to make out. Let us see, there is one baby stuck to this side and there is another baby which is stuck to this side, and you have a confusion whether there is a one big placenta or 2 average placenta which are stuck. So if there are 2 placentas which are stuck, then between the 2 placentas there will be some tissue going out, and that tissue, that chorionic tissue which is going out of these 2 placentas, will be invaginating between the 2 amniotic sacs. So if you imagine, this is like a peak of, it's like a peak of chorionic tissue between the 2 amniotic sacs. If you turn this like this, you may make out that there is a peak like this. That is what is a twin peak sign, also called the lambda sign. So yes, if you see the lambda sign, you know that this is a dichorionic diamniotic twinning. Or you may not see this sign. There might be just a nice continuous placenta, and between these 2 sacs there is no such distinction. Yes, now that is what we see. It looks like a T here. Yes, there is not much tissue between the 2 sacs. So yes, that is what is called a T sign. If you see a T sign on the ultrasound, then there is one placenta and there is no chorion coming out of it and invaginating between the 2 sacs. So yes, 2 placentas, 2 sacs, 2 different sexes. Or if you see the twin peak sign or the lambda sign, that will tell us that there are 2 different babies in 2 different sacs. Now they can also be the intertwin membrane thickness. This can be measured. If it is more than 2 millimeters, then it is suggestive of 2 placentas. See, we are having this discussion to tell you that on the ultrasound you cannot make out 2 placentas separately. So yes, when you cannot make out 2 placentas separately, look for these signs. If the intertwin membrane is more than 2 millimeters, or if there are 2 sexes, or there is a twin peak sign, then we know that it could be a dichorionic diamniotic twinning. Alright.